Today we're going to be talking about why we use chelation therapy in a lot of our treatments. And our typical go-to treatments are usually EDTA, DMSO or DMPS, and we also utilize EBOO in most of the treatments for detoxing, especially when it comes to heavy metals. So understanding chelation therapy and its benefits are important. So what does chelation therapy do? Well, a lot of people will acquire heavy metals from environmental exposures, foods, and other toxins that are usually found in foods, in soil, and every other day events. The sources of these heavy metals can come from pretty much anywhere. Fish, for example, are known to carry certain heavy metals, so it is important that you really find and use an organic source of food. Heavy metals tend to bind with certain agents, and some of those agents are things like EDTA, which binds a lot of lead, and cadmium. Lead and cadmium especially are utilized in treatments for cognitive decline in patients. DMSO is usually used to target mercury and arsenic, and DMPS is also another mercury chelator with benefits. Now, typically, you can utilize various different testing to see which one works for you. We like to use blood or serum, and then we can validate these tests as we chelate to see if there's any excretion of these heavy metals by doing a urine sample. Now, we also consider mineral replacement therapy because chelation needs to be done in a professional setting because you can actually chelate essential minerals that may be in your system, such as copper, etc. EBOO is one of the main treatments we do at our office, and EBOO is basically a blood cleanser where you run blood through ozone. It is a closed loop system, and you can actually incorporate this with other vitamins and minerals. Now, we actually use this as a futuristic treatment, especially when it comes to things like regenerative medicine. Chelation and EBOO share, though, a goal of reducing toxins in your body, thus allowing your body to heal. So, who should get evaluated? Individuals with occupational exposure or chronic conditions may benefit from assessment and tailored chelation therapy. Usually, sessions can last an hour to an hour and a half, or we actually prefer some newer technology that utilizes oral chelation, especially for children. The side effects are minimal in that event, and you can actually utilize different types of lab work to make sure that you're doing this safely. EBOO is actually very safe, and we actually utilize blood work before doing EBOO. The side effects are minimal because a team member will be with you, watching you through the treatment the whole time. You can also call us at 405-848-7246. You can visit the web at venturesclinic.com, or you can visit us on email at venturesclinic@gmail.com, and we would love to be in touch with you and have a consultation to see if this might be right for you.